So you've had knee surgery. In fact, you have brand new titanium knees. You've had knee replacement, but you still have pain. That's an issue that I'm seeing more and more of, and that needs to be solved because people are living so long with these artificial knees. Well, we can do something for that. We don't have to throw our arms up and just resign ourselves to never hiking again, never playing with the grands again. That does not have to be you. In fact, we have a very effective treatment for this type of pain. It's called a genicular nerve block. And basically, I'm just deadening the nerves that are going into your knee. You don't need them to walk. All they do is cause you pain. We can deaden those nerves for up to a year, and you get to go back to your usual routine. It's an in and out procedure, and people get so much relief, and more important, you get so much function back. Another group of folks who may benefit from a genicular nerve block are those who just are not able to get a big surgery like a knee replacement. Sometimes you have some other medical issues or other concerns where it's just not an option for you. Well, you don't have to live suffering with that pain. I can do this procedure, the genicular nerve ablation, and give you long-term pain relief. If you need to repeat it, we can. But the nice thing is during that year of pain relief, you're going about your business, able to do much more than the suffering you were having beforehand. So the most common things to happen with ablation actually is just an irritation of the nerve itself. They don't like to have heat around them, and that is what makes them deaden for a long while. So what we can do is place medications in that area to decrease some of that inflammation and pain, and it does go away eventually. It's an injection, so anytime we enter the body, there are risks. But in the grand scheme of things, the risks from any of the types of procedures that I do, especially injections, are less than the risk of you driving to come get them. So it's very safe.